Hello, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is purely for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today I will talk about eczema and how this can be treated. Eczema is an inflammatory skin condition that can make the skin dry, itchy and flaky. There can be scaly patches, blisters and skin infections. The exact cause of eczema is not fully understood. Eczema often happens in people who have allergies and it can be related to asthma and hay fever. It can also run in families. Another term for eczema is atopic dermatitis. Unfortunately, there is no cure for eczema at the moment. However, the symptoms of eczema can be managed well with various medications and measures. The usual treatments for eczema consist of emollients, steroid creams, and antihistamines. For common and uncomplicated eczema, the following regime can work. 1. Topical emollients and lotions can be applied to the affected areas, and common choices are Aveeno, Oilatum, Diprobase, or Double Base. 2. Steroid cream such as hydrocortisone is known to help with eczematic rash and this is available over the counter. A steroid cream should not be used for more than 7 days at a time as this can thin the skin. It may be used for more than 7 days only if this has been recommended by a doctor. 3. Antihistamines such as chlorphenamine or Piriton, loratadine, cetirizine, or fexofenadine are thought to help with the symptoms of eczema, particularly if there is excessive itching or irritation. Piriton and loratadine are available for young children, but a prescription may be required for under 2-year-olds. It is not recommended to apply calamine lotion for eczema as it may aggravate the situation. The other treatments that are available to treat eczema are tacrolimus 0.03 to 0.1% ointment or pimecrolimus 1% cream. These can only be prescribed by a doctor and are not available over the counter. Eczematic rash can be triggered by certain factors, and so it is advised to avoid any possible triggers and aggravating factors. These could be sweat, clothing, skin products, cold weather, perfumes, dust or smoke. The emollient can be used up to 4 times a day during flare-ups. It can be used when the skin feels dry, and at nappy change in babies. Emollient is normally applied at the direction of hair growth and not rubbed in. Hydrocortisone 1% is recommended for face and flexures for infants and children. Emollient can be continued during and after steroid treatment. Hydrocortisone 1% cream once daily is safe to use on the eyelids, and periorbital area or around the eyes. For regular flare-ups, hydrocortisone 1% to the eyelids twice a week regime can work. Alternative treatment for eyelid eczema is topical tacrolimus 0.1% or pimecrolimus 1%. Oral steroids for more severe cases or flare-ups of eczema are available and can be prescribed by a doctor for a very short term. For recurrent infected eczema, chlorhexidine containing emollients, and bleach baths once or twice a week can help. Specialized treatments of eczema are available and these include cyclosporin, azathioprine, mycophenolate, aletoteinoin, and methotrexate. There are very new treatments for eczema and these are JAK inhibitors, and biologic dupilumab. It should be noted that these treatments can only be prescribed by a dermatology specialist and only if the conventional treatments do not work. If conventional treatments and measures fail to control eczema, it is recommended to see a doctor for further assessment, and a referral to see a dermatologist for specialist management can be considered.